what do you do when caregiving becomes too much and you're really overwhelmed? Today, you'll learn why you need to take a break, cost and requirements and expectations of different available respite care options explained, and then easy first steps to get that type of care. The truth is, most people wait way too long before they seek out help with caregiving. Caregiving is really hard, and when you're burnt out, your health suffers, and the person that you love and caring for, their health is also going to suffer. It's a cycle of exhaustion, and a lot of people underestimate how much it takes to be a caregiver. That's why we want to talk to you today about respite care. Respite care does not mean you're abandoning your loved one. A lot of people take on the task of caregiving without fully understanding just how emotional and physical of a toll it's going to take on your body. Respite care can really come in and give you a breath of fresh air. So let's talk about what respite care is. It is short-term relief that prevents burnout, and it improves your capacity to care. It's also often a necessary boost that people need for emotional and physical well-being. And it's something that loved ones actually often enjoy. It's a break for them too. One of the most common ways people are first introduced to respite care is through adult daycare. Unfortunately, this isn't super common in West Virginia, but there are places that you can go to for this. This is usually the easiest to get into, and it is the least expensive. This is for seniors that need a little bit of support, a little bit of supervision, but they're still living at home alone and on their own. The requirements for adult daycare vary center by center. I did not have a guest on for this one because there is often a pretty long wait list for this, and I didn't want to overburden any centers that are currently in our area. The typical cost for this is anywhere between $50 and $150 a day, and often there are programs that are available to help you pay for those based on a sliding fee scale. This is really good for people who just need short stays away from home, so maybe they can run errands, or they just need a day or two a week so that the caregiver can continue living their life, doing the things that they need to do, and it gives the loved one some much needed social activity to allow them to get out of the home. I have Carrie Payette with Amada Senior Care with us today to talk about in-home care. Carrie, before we get started, let's do a clarification here, because home health and in-home care are two things that are often confused, and I'm sure you encounter this almost every day, right?
Absolutely. I'm so glad you asked me that question. There is a lot of confusion around that topic. So home health care is the medical component. Let's say you're recovering from an illness or an injury, you're going back home, but you need a little skilled care. So maybe you're having physical therapy, or a nurse is coming in and making sure your vitals are good, or doing some lab work. That is home health care, considered skilled. In-home care is considered non-medical, and that mainly is caregiving services. Now, they can help with a full range of things, from personal care, which could include things like bathing, dressing, toileting assistance, medication reminders, and they can usually also help with things around the house, like meal prep, light housekeeping, laundry, all those things. So if you call your home health care company and ask for those services, they're going to tell you no. Home health is what comes to mind, but think home care if you need some respite services.
I really wish there was a different name for this, because this is something that people get confused with a lot. And home medical will come in and they expect home medical to also help with chores and bathing. It's just, that's not how the guidelines work. And it's very confusing for a lot of people.
It is. And the other thing to remember too, Tabitha, is you can have both. It doesn't have to be one or the other. Oftentimes they pair well hand in hand.
Completely agree. So in-home care is actually what you do through Amada Senior Care. So tell us about how respite care works with this.
As we talked about previously, we're doing the personal care and the household stuff. Respite care can be a wonderful component. A lot of times a spouse is a full-time caregiver, but they still have things they have to do. They have, appointments, they have social engagements, but they feel torn because they don't want to leave their loved one at home. Home care can come in, Amada Senior Care can come in and provide respite care for, a few hours a day to when someone goes away on a trip. There's different types of respite care, it can be a huge difference maker. Generally, we find someone just starts with a few hours a week of respite, and then they just are so relieved that all of a sudden they're like, I think I need some more hours. I think I need some more hours. Another good example for respite is nights. We get a lot of people asking for nighttime care because if you can't get your sleep, it's hard to be a good caregiver during the day. So if you have someone in to give you the respite at night, then you can resume your regular caregiving role during the day.
It seems like a lot of people are resistant to admitting that they need help. But I think, as you just touched on, once they start receiving the help, it is a huge relief and they realize how their mental health and physical health needed that break.
Absolutely. They forgot they could feel so good a lot of times when they're getting that little bit of either mental health break or sleep or whatever it is. If you're a 24/7 full-time caregiver, that's exhausting. As you said, mentally, physically, emotionally, it really takes a toll. And generationally, that's what people want to do. They want to take care of their spouses with the people that we're dealing with. But if it's come to the point where it's a 24/7 job, it's almost impossible to do without some help and get some respite.
Absolutely. This next type of respite care, a lot of people don't even know this type exists. I have Carrie and Lisa from Genesis today, and they're going to talk to us about facility care.
The difference between in-home care services and facility services are that we can provide a patient with 10 to 14 days or longer stays for some relief for the caregivers. So it's often referred as a gift of time because it provides relief to the caregivers while providing the patients with the help they need. Respite services can be an ideal answer to the dilemma of where to turn when an older adult needs temporary assistance or aid.
So when we talked about adult daycare is going to be a very short stay, a couple hours or a day, maybe a couple times a month. And then in-home care, that could be anywhere from a couple hours a day to several days a week. This is more maybe if someone's going on vacation, maybe the caregiver is sick or just really mentally drained and needs a big break. Would that be a correct way of thinking of this?
That is correct. If you're the primary caregiver for an elderly family member or a loved one, you're going to at times feel overwhelmed or worn out, given the round-the-clock supervision that you're providing. That leads to sometimes neglecting your own health or family life because you're 24/7 dedicating yourself to their healthcare needs. You and your loved ones, they sometimes need to go to surgery or like cataract surgery or need extra assistance after recovery from a day surgery. That's also something we can provide and get you the rest that you may need as a caregiver. You might need that break or a vacation even. I mean, we all need some time away. So if you need a safe place for your loved one while you tend to your own matters, that's where we come into play.
And tell us a little bit about what it's like to stay at one of your facilities.
Okay, so that's kind of up my alley because I was actually the director of admissions at a skilled nursing facility for 32 years prior to taking on this role as director of post-acute partners. Within a center, it is 24-hour care. What we recognized several years ago was families need to get away. They need that vacation. They need to be able to attend a wedding. And as Carrie was talking about, being a caregiver is exhausting. It's not just physically taxing, but it's also mentally taxing. So being able to have your loved one in a safe 24-hour center with around-the-clock nurses, nutritious meals, activities, still being able to get their hair done, go play bingo, have fun, knowing that your loved one is there, that's a reassuring thing. And one of the things that we do when a family member calls or would call me when I was the admissions director, I would invite them to come into the center. I wanted to sit down with them and go over what the criteria is, give them a tour, introduce them to some of the key people that are, working in the facility as healthcare providers, whether it be the therapist, the registered dietitian, the physician on staff, the nurse practitioner. When they go in and they recognize that it's just not your mom and pop's nursing home anymore, it's a skilled setting, but it's also a really nice community where they can have the advantages of being home within that center. I think once they come in and tour, we can sit down and most importantly, identify the time that they're going to need for the respite care. The sooner that we know, the better that we can plan and schedule that family member's loved one to come into the center. Skilled centers stay pretty full. So the sooner we know, the better. We go over what the requirements are for them to admit. Even under respite, we treat it as a new admission. We want to know what their health background is, what medications they're on, what their diet is, what their likes and dislikes are. Because even during that 7 to 14 day period, we're still going to establish a plan of care that's conducive for them. Maybe even give them some therapy, get their hair done in the beauty salon. You know, we want to make sure that we're fixing their coffee the way that they want their coffee every morning or every evening. So, you know, that meeting and interacting with the family right out of the gate, maybe even bringing their loved one in to show them around. But knowing that they have that 24-hour safe, reliable care while they're out of town, it's such a breather. I mean, it just, you know, gives them such a more peace of mind while they're out of town.
I'm so thankful that you guys were here today to help spread the word on this, because again, this is such a wonderful way of getting respite and a lot of people don't know about it. So thank you guys so much. Hospice is another type of respite that I almost feel like is a secret. A lot of people are not aware of this, and we have Sierra Jones with Hospice here with us today to talk to us about it.
Hey everyone, so I'm Sierra Jones, a liaison with hospice care. And yes, Tabitha, you're right. There are so many people that don't know about hospice respite. And so what that is, it's for patients who are already on hospice care services. And we do offer respite services for those patients. So hospice itself doesn't offer a nurse to come in, move in with you 24/7. So there are times when caregivers may need that respite break, just to give them a break to go on vacation, run some errands, go to the doctor. So under the hospice benefit, we do offer at our inpatient facility 5 days every 30 days. So what this means is patients can go to our inpatient facility up at the Hubbard House or in Greenbrier, the Peyton House, and they can stay there 24/7 for up to 5 days. So they don't have to use those full 5 days. They can use one of those days. They can use 2 or 3, however many, or they can use the full 5, and then they can get that again in 30 days. And so that's a free respite service while on hospice for the caregiver to get that break to do whatever it is they need to do. And we always like to sort of flip it for the patients and let them know that it's also a break for them. And so we always try to encourage them that it is not that they're a burden to their family or their caregivers. It's just to allow those caregivers and family members to do some things that they need, and we will spoil those patients while they're in our unit. And I always joke with them and say that we will spoil you and you won't be able to wait until it's your turn to come back to us for respite, because we do just have such a great time with those patients while they are staying with us.
I love that, because I think there's so much guilt that's associated with people using respite. And one of the things that all of the speakers have talked about is patients enjoy it so much. It's so good for them. It just increases the mental health of everyone that's involved.
Absolutely. A lot of caregivers and family members are reluctant to use it. No one really is just eager to use it right off the jump because they feel guilty and they feel that their loved one will feel like a burden. So once they really sort of see what that benefit includes and they use it, they just are so astounded at the care that their loved one received. And like I said, most oftentimes the patients go back home and they can't stop talking about the care that they received during their respite stay. And not to mention, visiting hours are unlimited. So the family and caregivers can still come and visit their loved one anytime while they're doing that respite stay. So that's a nice peace of mind as well, to know that it's not something that they have no contact with their loved one while they're doing their respite stay.
Sierra, thank you so much for hopping on and talking about this. Again, another secret that's much needed for people to know about. So I really appreciate it.
Absolutely. Thank you for having me.
So as a recap, there's probably a lot of different respite services that we talked about today that you were not aware of. The one with the least requirements to get into is adult daycare. That is the most affordable. It's often available on a sliding fee scale. However, there is often a wait list to get in, and it's not as readily available. In-home health is the next one that's available, and that one is the one that people most commonly think about. That one is available on an hourly basis, and this provides care for you at your home. Facility care is a little bit more complicated to get into because you do have to allow them time to make sure there's space available and a bed. And this one is for longer stays. And then we have hospice care. And hospice is if you're already a patient with hospice, you can get 5 days every 30 days. Some of the biggest worries that people have about this is it's too expensive. This is again where advanced planning comes in. There are programs that are available for low income people, but there are a lot of services that are also available for private pay only. Medicare does not cover the majority of this type of care. They will for hospice, but that is pretty much the only one. So we do recommend that you plan in advance for this. This is not something that you can just last minute get the type of long-term care coverage that will cover these services. There's also the thought that a lot of people have is no one is going to love for them the way that I will love for them. And that's true. If you're a caregiver, you do have a special bond, but respite care is about allowing you to keep that special bond without the exhaustion and stress that comes with it. So sometimes just a short stay with respite will allow you to be a better caregiver. And another fear is often they're going to be scared without me. For the most part, that is an unwarranted fear. The person receiving the care often loves the socialization that comes with it, the new faces, the excitement. By far, respite care is something that is really enjoyed by the caregiver and the care receiver. Using respite services, taking care of yourself, thinking about your own health is going to reduce depression for yourself. If you are the caregiver and you are depressed, the person you're caring for is going to pick up on that energy. And so take care of yourself and your mental health. Respite improves quality of care for both you and the person receiving the care. And it helps you have an identity outside of being a caregiver. You deserve to be a person of your own and not just be identified as a caregiver. So a couple helpful tools that we have available for free. We do have a long-term care planning guide that will be linked in the comments. It goes through what Medicare covers, what it doesn't, the different types of long-term care that's available. It's not like the old type of planning where there was only one way to do this. There are lots of new and exciting ways to cover long-term care. We also have a private Facebook group, WV Medicare Question, and we offer lots of webinars and information and free resources in there. And then for anyone who calls in with us, 681-340-1377, we do offer free planning sessions to help you prepare for your own long-term care journey. I hope this was really helpful for you today, and don't forget to care for yourself. Can't pour from an empty cup.